Dr. Alex Romano is a chiropractor and personal trainer at the Form Lab in Falmouth. Here, it is all about changing the way we move to get the most out of our workouts. Thanks so much for helping us out and showing us some movements today. So you're going to be showing us some movements that kind of keep our spine in mind while we're working out.
Yes.
Why is that so important when we're working out?
Yeah, so our spine needs to be mobile in order to allow us to access ranges of motion so that we can use the proper muscles when we're doing these movements to avoid pain and to have functional movement throughout our daily activities.
Yeah, so pretty important stuff.
Yeah.
So we have a guest here with us today, our producer, Aaron Tangway. He's going to be helping out with our movements. So what do you want to start with? What's the first thing you want us to do?
Yeah, so the first area that we're dealing with is going to be the cervical spine, which is this area of our neck. So we're going to be doing a scapular push-up. So what you'll do is you'll place your hands on the barbell or a wall, and then what you'll do is you will drive your chest towards, keeping your elbows straight, drive your chest towards the bar, feeling those scapular blades coming back together back here. And then what you're going to do is you're going to push your back out, rounding the back, really focusing on that movement of the scapular blade around the rib cage. The goal here is to make sure these muscles stay relaxed because these muscles are what connect into the neck and can commonly cause neck pain, headaches, and things like that.
I was going to ask about that. So how can movements like this help with neck stiffness and all of that?
Yeah, so if we are able to access the proper range of motion in that shoulder blade, we can then properly use the muscles of the lower trap and the serratus, allowing these muscles to relax. So, you know, during the day, we're always kind of working in front of us in that flex position. So doing this will allow us to remind our body how to access that other range of motion, the better range of motion.
Yeah. All right, what else you got for us?
Yeah, so the next area we're dealing with is the thoracic spine, which is this area right here. So similarly, he's going to be putting his hands on the barbell or a wall. And then with this one, you're going to be driving your hips straight back, and you're going to be pushing your head through your arms. So what this is going to do is it's going to allow for a lot of extension in the thoracic spine here. A lot of my patients will present with a stubborn pain between the shoulder blades. So doing this movement combined with that scapular push-up can help to open that area up and remind our body the movements that it needs to maintain. What you'll do when you're doing this is you'll bring it into that down position. You'll take 2 deep breaths, really feeling that expansion into the rib cage, and then you'll come back up. And you'll make it a dynamic movement. This is something that you can do, 2 sets a day, do about 8 to 10 reps, to tolerance.
And deep breathing, probably really important for something like this.
Yeah. So obviously breathing is important because our muscles need oxygen to relax, but also all of our ribs connect and articulate with our spine. So if our rib cage isn't mobile, then we're not going to have as much mobility in the thoracic spine.
Not going to get as good of a workout in.
Yeah.
Exactly. All right, Aaron, you were doing a great job. Great job. What else do you have for us? Last one.
Yes, our last one has to do with the lumbar spine. So, and that's this area of our lower back here. You're going to step up onto an elevated surface like this yoga block here. And then what you're going to do is you're going to keep this hip very stable. You're going to allow that leg to drop down. And then you're going to lift it up, feeling that pull from that back part of the pelvic bone. So what I commonly see with patients is that they'll get a lower back pain either, along the side of the spine or on one side of that lower back, and this can help address movement in the pelvis.
So how does it impact you're the spine expert here, the lumbar spine area?
Yeah, so the pelvis directly connects with the lumbar spine right there through the sacrum, and then it has muscular attachments. So if the pelvis is tighter on one side due to this muscle that he's using right here, it can pull the pelvis up on one side, which will cause the lumbar spine to curve.
Okay.
Yeah.
Probably not very comfortable.
Yeah, so doing a movement like this can help gain awareness of your pelvic position, which can allow you to maintain better movement patterns through the day.
All right, 3 easy moves that we can all do at home. High five, dude. Great job. And you left her hanging. Thanks again, Alex, for having us come in.
Thank you, Sam.
If you would like to learn more about the Form Lab, everything we just did here, the movements, all of that, just head to the 207 section of our website and app. Don't go anywhere. 207 is back right after this.